Welcome to Linguistica's Laboratory Studies training. Today, we will be reviewing laboratory studies and tests, common laboratory tests, blood chemistry test, blood gas panel, coagulation test, hepatic function, comprehensive metabolic panel (CMP), urinalysis, stool test, and HbA1c. Hello, interpreter. This training has a voiceover, so you can follow along as it is read to you. Feel free to change the speed at which it is played, pause, rewind, or forward it. It is important to read all the information provided. Let's begin! Laboratory studies and tests. Laboratory tests check a sample of the blood, urine, or body tissues to provide insight into body functions and contents. The tests use ranges rather than a single value because what is normal differs from patient to patient. They are often a part of a routine checkup. They also help doctors diagnose medical conditions, plans or evaluate treatments, and monitor diseases. There are many factors that affect test results, such as sex, age, and race, dietary habits and medication, procedure technique, and pre-test instructions. Why do some blood tests require fasting? Some blood tests require fasting, abstaining from all or some kinds of food or drink beforehand. In these cases, the provider will instruct the patient not to eat or drink anything after midnight, the night before the test. The vitamins, minerals, fats, carbohydrates, and proteins that make up all food and beverages can impact blood level readings, clouding the results of the test. Blood tests that the patient will likely need to fast for include blood glucose test, liver function test, cholesterol test, triglyceride level test. As medical interpreters, it is important to know this as we often hear, do not eat or drink anything after 12 o'clock midnight the night before your test. Chemistry panels. Chemistry panels are groups of tests that are routinely ordered to determine a person's general health status. The tests are performed on a blood sample, usually drawn from a vein. Electrolyte panel. A helpful study for detecting problems with the body's fluids and electrolyte balance. Lipid panel. Lipids are fats. The test is used to assess a person's risk of developing cardiovascular disease. Liver panel, also called hepatic function panel. This is used to screen for, detect, evaluate, and monitor acute and chronic liver inflammation, hepatitis, liver disease. Chemistry panels. Chemistry panels are groups of tests that are routinely ordered to determine a person's general health status. The tests are performed on a blood sample, usually drawn from a vein. Thyroid function panel. This helps evaluate thyroid gland function to diagnose thyroid disorders such as hypothyroidism. It evaluates several thyroid hormone levels. Lipid panel, known as kidney function panel, this test contains albumin, creatinine, BUN, and EGFR to evaluate kidney function. These terms will be explained later on. Lipid panel test. What to expect during a lipid panel test. 1. Phlebotomist draws blood. 2. Levels of fat in blood are measured. Fat equals cholesterol plus triglycerides plus lipoproteins. 3. High levels mean increased risk for heart and vascular disease. Common laboratory test. It is the most common laboratory test. The test is used to analyze and compare levels of hemoglobin, red blood cells, white blood cells, erythrocytes, leukocytes, and platelets. Analyzes and compares levels of glucose, urea, creatinine, electrolytes, and uric acid. This is part of an important routine checkup for cardiopathy, diabetic, and hypertensive patients. Hepatic function panel.
This test is used to analyze and compare levels of albumin, total proteins, bilirubin, and hepatic enzymes. It is especially helpful in patients with liver disease.
Common laboratory test. Lipids panel. This analyzes and compares levels of cholesterol and triglycerides. Blood gas panel. A test used to analyze and compare levels of CO2, O2, bicarbonate, and pH. It is especially useful for diseases that involve the kidneys and lungs. Urinalysis. Also called a clinical urine test, it is useful for analyzing urine's color, density, and pH. The test looks for proteins, bacteria, and blood cells which may be found in infected patients, STDs, and/or kidney disease patients.
Blood chemistry test. It is a test performed on a sample of blood to measure the amount of a certain substance in the body. These substances include electrolytes such as sodium, potassium, and chloride, fats, proteins, glucose or sugar, and enzymes. Blood chemistry tests provide important information about how well a person's kidneys, liver, and other organs are working. Healthcare providers usually say blood work instead of blood chemistry. Blood gas panel. A blood gas test measures the amount of oxygen and carbon dioxide in the blood. This test is normally a bit more painful than a regular blood test since it is taken from the artery, not the vein. It may also be used to determine the pH of the blood or how acidic it is. The blood gas test can determine how well the lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. Here we can see the samples of the arterial blood sample and the venous blood sample. Blood gas panel. Imbalances in the oxygen, carbon dioxide, and pH levels of the blood can indicate the presence of certain medical conditions. These may include kidney failure, heart failure, uncontrolled diabetes, hemorrhage, chemical poisoning, drug overdose, or shock. Coagulation test. Coagulation test measures a patient's blood ability to clot and how long it takes to clot. Testing can help the doctor assess a patient's risk of excessive bleeding or developing clots somewhere in their blood vessels. This is more likely to be done when a patient is scheduled for surgery. It is more common to hear about this test when a patient is requested to have a medical clearance before a surgery. Here we can see a panel that shows us bleeding time, activated partial thromboplastin time, prothrombin time, thrombin time, and fibrin degradation products. Hepatic function test. The panel evaluates hepatic enzymes like alanine aminotransferase (ALT), alkaline phosphatase (ALP), and aspartate aminotransferase (AST). These are enzymes found in the liver that play a role in metabolism, among other functions. Total bilirubin and direct bilirubin are also measured. These are byproducts of the normal breakdown of red blood cells. Bilirubin passes through the liver and is excreted from the body. However, if that does not happen due to the liver disease, then bilirubin level in the blood can rise and the skin can take on the yellow discoloration known as jaundice. Doctors often say, "Your liver function test, liver enzymes came back fine," as they do not usually read out loud all the results. Comprehensive Metabolic Panel, CMP. A CMP may be ordered as a part of a routine medical exam or physical, or to help diagnose conditions such as diabetes, liver, or kidney disease. The CMP may also be used to monitor chronic conditions or when the patient is taking medications that can cause certain side effects. The CMP helps evaluate glucose, calcium, albumin and total blood protein, sodium, potassium, carbon dioxide and chloride, which are the electrolytes, blood urea nitrogen, BUN, and creatinine, alkaline phosphatase, ALP, alanine aminotransferase, ALT, aspartate aminotransferase, AST, and bilirubin. Urinalysis. A urinalysis is a test of a patient's urine. This test is used to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. A provider may recommend a urinalysis as part of a routine medical exam, pregnancy checkup, pre-surgery preparation, or on hospital admission. It can help to screen for a variety of disorders such as diabetes, kidney disease, and liver disease. It helps diagnose several medical conditions. A medical provider may suggest a urinalysis if the patient is experiencing abdominal pain, back pain, frequent or painful urination, blood in the urine, or other urinary problems. Urinalysis. A urinalysis also helps continue monitoring a medical condition such as kidney disease or a urinary tract disease. Unusual urinary results often require more testing to uncover the source of the problem. Urine culture. Urine cultures find bacteria from a urine sample, which are grown in a laboratory, to diagnose a urinary tract infection. Bacteria can enter through the urethra and cause urinary tract infection. Cultures are not part of a routine analysis. This must be requested by the provider separately. It takes 1 to 3 days for the results of the urine culture test to arrive. Stool test. A stool culture, better known as a stool test, involves the collection and analysis of fecal matter to diagnose the presence or absence of a medical condition. The main purposes for this test include fecal culture. This test is used to determine what types of bacteria are present in the digestive tract. Fecal occult blood test. This test is used to check for blood in the stools, meaning there is likely some kind of bleeding in the digestive tract. It may be caused by a variety of conditions such as polyps, hemorrhoids, and diverticulosis. Blood in the stool may also be a sign of colorectal cancer. You might hear the provider say, "The nurse will give you a container. Please collect the stool sample and bring it back to the laboratory." Glycosylated hemoglobin test. This test, also referred to as hemoglobin A1C or HbA1c, the A1C test measures the amount of hemoglobin in the blood that has glucose attached to it. Since it is a test that provides an average of the blood sugar readings for the past 3 months, the patient is not required to be fasting. It is used to monitor blood sugar levels as well as for diagnoses and screening of prediabetes and diabetes. Since we are medical interpreters, it is important that we are familiar with this term. As doctors often say, your A1C came back high, normal, better. And we can see in a little chart that says without diabetes, your A1C should be less than 5.7%, and with diabetes, it should be around less than 7%. Pap smear test. A Papa-Nicolau test, Pap smear, also called a Pap test, is a screening procedure for the cervical cancer. It tests for the presence of precancerous or cancerous cells on the cervix. The cervix is the opening of the uterus. This is not a laboratory study per se, but since it is very common during calls, we will mention it. Current guidelines recommend that women get regular Pap smears every 3 years starting at age 21. Women who have had a hysterectomy with removal of the cervix do not need screening. A sample of cells is taken from the cervical area during a pelvic exam using a swab or a small brush. The cells are processed onto a glass slide, stained, and examined by a cytotechnologist or a pathologist. Pap smear test. As medical interpreters, it is important that we are familiar with the procedure since it's very common to interpret the following instructions. During the test, please undress from the waist down, taking off pants and underwear, put the gown with the opening on the front, and let me know when you're ready. Please lie on your back on the examination table with your legs spread and your feet resting on the supports. I will slowly insert a device called speculum into your vagina. You might feel some discomfort. I will use a spatula brush, cytobrush, to take a sample. After the test, you might feel mild discomfort from the scraping or a bit of cramping.
You could also experience very light vaginal bleeding. Come to the clinic if the discomfort or bleeding continues the day after the test. Thank you. Please check the glossary. Have a good day.